Adrenal insufficiency is a condition that occurs when your adrenal glands don't produce enough of certain hormones. The adrenal glands are small, triangle shaped glands that sit on top of your kidneys. Despite their small size, they play a crucial role in your body. They produce several important hormones, including cortisol and aldosterone. Cortisol is often called the stress hormone because it helps your body respond to stress. But it does much more than that. It also helps regulate your metabolism, controls your blood sugar levels, reduces inflammation, and helps control your blood pressure. Aldosterone, on the other hand, helps control your blood pressure by managing the balance of salt and water in your body. In adrenal insufficiency, your adrenal glands don't produce enough of these hormones. This can happen for different reasons, which we'll get into later. But the result is that your body doesn't have enough of these crucial hormones to function properly. There are two main types of adrenal insufficiency: primary and secondary. Primary adrenal insufficiency, also known as Addison's disease, occurs when the adrenal glands themselves are damaged and can't produce enough hormones. Secondary adrenal insufficiency happens when the pituitary gland, which is located in your brain, doesn't produce enough of a hormone called ACTH. ACTH normally stimulates the adrenal glands to produce cortisol, so without it, cortisol production drops. Adrenal insufficiency is considered a rare disorder. Primary adrenal insufficiency affects about 1 in 100,000 people. Secondary adrenal insufficiency is a bit more common, affecting about 150 to 280 people per million. However, it's possible that these numbers are underestimates because the condition can be difficult to diagnose. Causes of adrenal insufficiency. The causes can vary depending on whether it's primary or secondary adrenal insufficiency. For primary adrenal insufficiency, the most common cause is autoimmune disease, accounting for about 70% to 90% of cases. This is where your immune system, which normally protects you from diseases, mistakenly attacks your own adrenal glands. Over time, this damages the glands so they can't produce hormones properly. Other causes of primary adrenal insufficiency can include infections, like tuberculosis, cancer that has spread to the adrenal glands, or certain genetic disorders. Secondary adrenal insufficiency has different causes. Remember, this type is due to problems with the pituitary gland not producing enough ACTH. This can happen if you have a tumor in your pituitary gland, if you've had brain surgery or radiation therapy that affected your pituitary gland, or if you've been taking corticosteroid medications for a long time and then stop suddenly. These medications can suppress the production of ACTH by the pituitary gland, leading to reduced cortisol production by the adrenal glands. When the medications are stopped suddenly, the adrenal glands may not be able to resume normal cortisol production, resulting in adrenal insufficiency. Symptoms of adrenal insufficiency. The symptoms of adrenal insufficiency can be subtle and develop gradually over time, which is one reason why the condition can be challenging to diagnose. People with adrenal insufficiency often experience extreme fatigue that doesn't improve with rest. This isn't just feeling a bit tired. It's a deep, persistent exhaustion that can significantly impact daily life. Alongside fatigue, many individuals notice weakness, finding it difficult to perform physical tasks that were once easy for them. Weight loss and decreased appetite are common symptoms. You might find yourself losing weight without trying, or simply not feeling as hungry as you used to. Low blood pressure is another hallmark of adrenal insufficiency, often causing dizziness or lightheadedness, especially when standing up quickly. Many people with this condition develop unusual salt cravings, finding themselves reaching for salty foods more often than before. Digestive issues are also common, particularly in primary adrenal insufficiency. These can include nausea, vomiting, and abdominal pain, which can sometimes be severe. Muscle and joint pain are frequently reported, with individuals experiencing aches and pains throughout their body. The hormonal imbalance caused by adrenal insufficiency can also affect mood, often leading to feelings of depression or irritability. In cases of primary adrenal insufficiency, also known as Addison's disease, people might notice a darkening of their skin. This hyperpigmentation is most noticeable in skin folds, scars, and pressure points like knees and elbows. Women with adrenal insufficiency may also experience loss of body hair and irregular menstrual periods. It's important to note that these symptoms can be vague and may come on so gradually that people might not realize something is wrong at first. Many individuals describe it as feeling like they're just not themselves, or that they're struggling to get through their daily activities. In some cases, adrenal insufficiency can lead to a life-threatening condition called an adrenal crisis. This can happen if your body is under stress, like from an infection or injury, and can't produce the extra cortisol it needs to cope. Symptoms of an adrenal crisis include severe abdominal pain, vomiting, diarrhea, low blood pressure, and loss of consciousness. This is a medical emergency and requires immediate treatment. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of adrenal insufficiency. If a doctor suspects adrenal insufficiency, they'll typically start with a thorough medical history and physical exam. They'll ask about your symptoms, any medications you're taking, and your family medical history. The next step is usually blood tests. These can measure your levels of cortisol, ACTH, and other hormones. However, a single blood test isn't usually enough to diagnose adrenal insufficiency. That's because cortisol levels naturally fluctuate throughout the day. To get a more accurate picture, doctors often use something called an ACTH stimulation test. For this test, you're given an injection of synthetic ACTH. Then, your blood cortisol levels are measured before the injection and at intervals afterward. In people without adrenal insufficiency, cortisol levels will rise significantly after the ACTH injection. If you have adrenal insufficiency, your cortisol levels won't increase as much. Other tests might include measuring your blood sodium and potassium levels, as these can be affected by adrenal insufficiency. Imaging tests like CT scans or MRIs might be used to look at your adrenal glands or pituitary gland, depending on which type of adrenal insufficiency is suspected. Treatment for adrenal insufficiency. Once adrenal insufficiency is diagnosed, treatment typically involves hormone replacement therapy. The goal is to replace the hormones that your body isn't producing enough of. For cortisol replacement, you'll usually be prescribed a corticosteroid medication. This might be hydrocortisone, prednisone, or cortisone acetate. These medications are taken orally, usually 2 or 3 times a day. The dose is carefully adjusted to mimic your body's natural cortisol rhythm as closely as possible. If you have primary adrenal insufficiency, you'll also need to take a medication to replace aldosterone. This is usually a drug called fludrocortisone, which helps regulate your body's salt and water balance. It's crucial that people with adrenal insufficiency take their medication exactly as prescribed. Missing doses can lead to symptoms returning or even trigger an adrenal crisis. You'll also need to work closely with your doctor to adjust your medication during times of stress, illness, or injury. During these times, your body would naturally produce more cortisol, so you'll need to increase your dose to mimic this. People with adrenal insufficiency also need to carry a medical alert card or wear a medical alert bracelet. This is important in case of emergencies, where you might not be able to tell healthcare providers about your condition. In addition to medication, lifestyle changes can help manage adrenal insufficiency. This might include eating a healthy diet, getting regular exercise as tolerated, and finding ways to manage stress. Some people find it helpful to keep a stress diary to track how different activities affect their symptoms. At the end, living with adrenal insufficiency can be challenging, but with proper treatment and management, most people are able to lead normal, active lives. Now, we want to hear from you. Do you or someone you know have adrenal insufficiency? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.